So welcome everyone. So this is a briefing about the Call Unanswered report and the No One Turned Away campaign. I'm Kate Colvin. I'm the CEO of Homelessness Australia, the national peak body for homelessness. And before we really begin, I'd like to acknowledge that we're having this conversation on Aboriginal lands across the country. And I pay respect to elders past, present and emerging, and acknowledge I'm joining from Wurundjeri country, and this land and many others, all the others, was never ceded. So welcome everybody. So we've launched the campaign now last Monday, and we had an amazing day. That was the busiest media day that I've ever done. And so I think that that's really great indication of the support in the community around this issue. People do feel really concerned about homelessness, and that's why, a lot of commercial media, it wasn't just the ABC, though we did get good pickup from the ABC, but it was also really a lot of traffic on commercial radio and news.com and other publications. So that shows that there's just real general community interest in this issue. So what we want to do with the briefing is that I think Angela and Nathan will run us through the report and the findings of the research, and then I'll talk a little bit about the campaign. So I think without further ado, I'll pass over to you, Angela.
Okay, thank you, Kay. And I'd also like to acknowledge country. I'm on Wurundjeri land today, and I pay my respects to elders past and present. So Nathan is going to bring up some slides. I do want to just start by also my name is on this slide, but it wouldn't be there without Nathan's very hard work throughout this entire project, including helping run the survey that many of you may well have participated in over 2 weeks back in September. So thanks to Nathan, and also putting together these slides. Just want to acknowledge that often. And he really should be putting his name on these slides as well. So the Call Unanswered report was launched last week to help launch the campaign No One Turned Away, and Kate and I had a great day up in Canberra. As she said, it was great to see her in action. An amazing advocate and communicator, and it was great to see the reach of the report. So today I'm just going to provide you with an overview and an opportunity for any questions you might have. So Nathan, did you want to go to the next slide? So I guess the thing we really wanted to highlight was, we know we're in a housing crisis. We're hearing about it almost as regularly as we hear about the cost of living crisis. We've seen national vacancy rates fall and remain very, very low for an extended period of time coming out of the pandemic. And we've seen rents continue to grow. And even yesterday, as we've seen headline CPI come right back down towards 2%, we still have rents running in the high sixes, almost 7% per year. So we remain in a housing crisis, and for many low-income earners in particular, that of course means there's a rental affordability crisis. We had SGS Consulting's Rental Affordability Index out earlier this week, which once again highlighted how unaffordable just Australia is for low-income earners in terms of renting at the moment. To the next slide. But what we haven't been seeing, at least from the official data, is that come through in terms of specialist homelessness services and the official Australian Institute of Health and Welfare data. And so when going to government and saying, well, we need to fix this crisis, there's been a bit of a deaf ear in terms of the role that specialist homelessness services play. We know anecdotally that demand is up. We know that the complexity of the cases that are being seen is increasing, but the official data isn't necessarily demonstrating that. And we can see that here in terms of the number of clients assisted, the unassisted clients. Now, this creates a bit of an issue when you're going to government and saying, well, we need additional resources, if they're like, yeah, but wait a minute, there's been no change here. Like that, yeah, there's a housing crisis, but it's not affecting homelessness. What we've understood, though, is that the official data misses a lot of things, and it's not telling us a lot of that, the actual picture on the ground. for example, to be counted as unassisted, individuals have to have been able to make contact with the service. So if people haven't even been able to reach a service, well, then they're not counted in these official figures. A lot of people don't even bother to reach out because they know that services are stretched and they're not going to be able to be helped. And the very definition of what unassisted is quite narrow. And so what you're really seeing in these figures is a sector that is at capacity. And so, yes, demand may be increasing, it may be more complex, but when you're at capacity, you're at capacity. And it's not necessarily telling us about that unmet demand. So what the project was really trying to highlight was, what is the unmet demand out there, and to quantify it and to provide a face to what that unmet demand might look like. So we used two primary research tools to do that. A survey and discussions with specialist homelessness services around Australia. And I have to thank all of them that participated. We had 23 services across the country. These I guess I don't want to be critical of other people that we survey, but often it's difficult to get a level of engagement. People are busy, people have a lot of other things on. It was very clear, even from the process that we went through, that people were very, very keen to have this data collected and this message heard. And we just really want to thank people for responding to the survey over the 2-week period. And then we also looked at modelling. So previous work had been done around the people who are at risk of homelessness by a HURI, a really solid methodological approach about what risk factors are at play in terms of contributing towards homelessness. But the last data that's based on was from 2016, and we thought there was probably some value in updating that to say, well, what's changed over time in terms of that at-risk population as a result of the rental affordability crisis. So to the next slide. As I said, we had 23 specialist homelessness services, 33 teams, people in regional, rural, across the different states and territories. It was a 2-week period, and we had discussions, one-on-one discussions, where we got some more qualitative insights as well. What we were trying to capture was the times when services were unable to be contacted. So what we had been hearing was that either services couldn't answer the phone, services couldn't respond to emails, services were having to lock doors. And so just to understand how often that was occurring, the visual the metric we were trying to get at is a similar one to ED. So when hospitals have to go on bypass, for example, it's a signal of a system at breaking point or beyond being stretched when they have to actually just stop taking people in. And so we really wanted to highlight that and to understand how often that was happening. The other thing was around who was being helped and who wasn't. So the triaging. So we understood that because resources are so stretched at the moment, people are having to make very difficult decisions about who they can assist and who they can't. And that hierarchy of need and what that actually looks like, and to get some numbers around who the services were able to support and who they were not on a given day. So what we found was that 39% of providers over the 2-week period were forced to close their front door at some point. And 1 in every 22 operating hours, doors are closed. 83% of providers were unable to answer the phone during some period of the survey, and calls couldn't be answered 1 in every 13 hours of operating hours. And 74% of providers were unable to reply to emails during the survey, and around 67 emails were going unanswered every single day. In terms of, it was really common for homelessness services to be unable to assist people with children who face homelessness, regardless of how urgent the need was. So one of the things we were trying to pick up, and we did this to varying degrees of success because of the different service types, was that services just didn't have the capacity to help people who were facing eviction, so to avoid eviction, with the majority of the focus on those experiencing acute homelessness. Unfortunately, even within that really high need group, specialist homelessness services are unable to meet the needs. So we found, for example, on 44 days were children who faced homelessness were being unable to be assisted. Or within 7 days, or sorry, Nathan, I'm not following this slide. Do you want to step in and save me from my own?
So of the 330 survey days that we did, services reported that they were unable to assist people with children who faced homelessness on a number of occasions. Now, the level of urgency is what's represented on this slide. Within 4 weeks, it was 66 days. Facing homelessness within 7 days, it was 53 days. And facing homelessness within 2 days, it was 44 days. Sorry, that could have been clearer.
No, that's all right. Sorry for me getting lost on those statistics. So to the next slide. So in terms of the share of survey, sorry, these are the data. This was the data that I was thinking I was reading off, and that's my confusion. In terms of people who had children and had no accommodation, of the 330 survey days that we covered, there was 21% of days where services were unable to provide services to that group. In terms of people with no dependents that had no accommodation that evening, on 51% of days, much more common, singles to be unable to be assisted. In terms of people with children that had access to a car, on 13% of days. And in terms of unaccompanied children, which is, I guess you would say, one of the most vulnerable groups within the community, on 11% of days, services reported they were unable to assist with urgent accommodation needs. So then modelling the at-risk population, so to be considered under the Huri framework to be at risk of homelessness, there are sort of 5 risk factors, and it's when individuals have to demonstrate 2 of these that they're considered at risk of homelessness. So they are being low income, being vulnerable to discrimination, having low social resources and supports, needing support to access or maintain housing, and rental stress. And what we did was we effectively redid the Huri work using at an Australian level. The Huri original work was much more localised, but we did it at the national level and across the states. And we saw a very big increase across the different groups in terms of those that were at risk. And this led to one of the, I guess, the bigger headlines in terms of the 3 million Australians being at risk of homelessness at the moment, which is an increase of around 60% since 2016. There's a number of reasons for that. There's a big increase in Victoria, which has a lot to do with poor mental health being increased, and that is a risk factor. Rental stress is the other one, and the number of people who are in groups that experience discrimination is the other one. So that's me, and really, really happy to take questions or explore some of these issues further with you, or allow Kate to take over and explain what is now being done in terms of the campaign.
Beautiful, thanks, Angela. So I'll just do that. So thanks for that. So yeah, it's been the report has been really well received. So I spoke before about the media attention, but it's also created space for some really important conversations with government. So and really that came talks to the genesis of the report, which was that when we're up in Canberra talking to politicians about the pressures on homelessness services, but the annual homelessness data shows that the number of clients is not growing, it becomes hard for us to really tell a story about the pressure on services. So this has really, I think, changed the narrative with government. I think certainly the conversations that we had last week when we launched the report with people in government, I think the recognition was there now that homelessness services are under enormous pressure and that there does need to be increased resources. So the next stage is then how do we press for those resources to come about? And so the launch of the campaign, which I'll just share with you now, is part of that process. So if I just share screen. So I just want to show you around the campaign website. So No One Turned Away is just a simple campaign, really. The objective really is summed up in the name of the campaign, is that we really feel like we need to have a homelessness service system that's gotten to the point where we can respond to everyone who needs that assistance. And the campaign asks are very simple. So you can see them here on the front page. It's really that we get to the point where we can provide the support that people need to avoid or quickly escape homelessness. So the homelessness prevention element is built in there, that we really need homelessness services to be able to assist people before they become homeless wherever possible, as well as being able to provide the crisis responses to people when they have become homeless already. And then we included the element in there about social housing, about income support, just because that's just so critical to outcomes in homelessness, both in preventing homelessness and in enabling us to respond. So there's a bit more detail on the website about what those elements of homelessness service delivery mean. And this was, to be honest, a bit hard to write because homelessness services provide such an enormous breadth of programmatic responses to people who are homeless. And we wanted this to be in language that people in the public could understand, not really just talking to our own, there's sort of very particular ways of talking about programs in homelessness services, like talking about IAP services and all of these kinds of things, but we're trying to communicate what homelessness services do to the general public and also to politicians. And to be honest, part of the challenge when I'm talking to politicians is that they often don't understand what homelessness support is and think that homelessness services just provide shelters. They can sort of see and touch and feel a refuge or a crisis accommodation service, but the kinds of human services support and case management support that homelessness services provide is not so easy for them to understand. So I've tried to describe some of those kind of main support elements there. And so really that's the outline of the campaign. And there's two ways of being a supporter. So we have individual supporters who, go on a list to get updates about the campaign, and people can join as an individual supporter on the front page just by clicking that button. And I think there's of that's being fixed by the web developers, because when you hit submit, it looks like nothing happens, but it does. The names do end up in the list. And then people can also join as organisations. So if you go to the organisational supporter page, organisations can add their organisation on there. So you can see that goes to a page on the Homelessness Australia website, and the logos just then land in the back end of the website, and I can put them up on the website when they come in. Just a heads up that the web developers haven't shown me how to do that yet. So I have got a few extra logos to put up, but they're going to tell me any day how to actually do that, which will be handy. So the other things to sort of fill you in on it, well, what can you do as an organisation that's participating in the campaign to assist us to achieve those objectives, which is to get more investment into homelessness services primarily. And as the campaign unfolds, we'll develop some activities that are shared activities, potentially a letter to the Prime Minister, or that all the organisations can sign on to, or individuals potentially sign on to as well, and other activities. But I think the intent is for it to also create space for organisations to interact with government independently, and some of those ways of communicating are more powerful than everything just being through a central organisation anyway. So I think there's such a wealth of information in the Call Unanswered report, and I would really encourage organisations to take the information and put together a letter of your own that is fleshed out with examples from your own service. So you can use, you could describe the pressures that are being felt at the particular service, and then also describe the impact that that's having on the clients that you serve. And I think that will be more powerful, a number of those letters going to government rather than just one, though we will, as I said, do those sort of joint sign-on letters down the track. The other way of raising the profile of the issue is using social media, and I was just going to show a couple of posts. I remember Homelessness New South Wales did a good one, which I cannot immediately find. But anyway, on social media, you can put information from the Call Unanswered report. Again, I would suggest fleshing it out with information from your own service. And another idea is to put information about the benefits of homelessness services. So whether or not that's, short interviews with clients who've used the service and the benefit that they have gained, and then some reflection from the organisation in the sort of body of the social media post, or other ways that we're really, I think the purpose is to talk about how important homelessness services are, the value that we deliver to the community, and then just sort of keep coming back to the main asks, which is that homelessness services are under enormous pressure and need increased funding. And those calls for investment can be directed either to the federal government or to the state government. So as the national peak body, my focus is the federal government, but obviously state governments also have budget processes that are underway and can increase investment in homelessness services. So either way, you can use the same information to go to both directions. And we didn't go through this in detail in the briefing, but in the Call Unanswered report, there is state-by-state information about the number of people at risk of homelessness and the increased number of people experiencing rent stress in each state as well. So what I'm going to do now is see if anyone has any questions, because that's the main elements that I wanted to share. So if I take that off, I'll be able to see people. Did anyone have any questions or want to share any examples perhaps of in the early days of the campaign? I know that there are a lot of organisations putting together social media posts. You might have some examples of posts that did particularly well that you'd like to share. Everyone's very quiet today. Oh, Tyrrell, I can see that you're talking, but you're on mute. Oh, no, you're not on mute.
What about now?
Yes, we can hear you now.
Excellent. That was a scramble for my little microphone. So just keen to know you talked a little bit about going forward with the campaign. Is this going to weigh into next year's election at all? Is there any plans to kind of do anything around that?
Yes. So in the immediate term, the conversation we've been having with government is about including investment in the mid-year budget statement, which will come out very soon. So then we'll know, I guess, what's left. So and so from there, it sort of can develop a bit more messaging about the election, but definitely in terms of the election period, we have already asked parties to include investment in homelessness services in their budgets. I mean, in their election platforms, but there's probably some more development of those. So some further conversations with those that needs to happen. And I think likewise, any organisations that have connections with, you know, sometimes people have such powerful connections with their local MP, and those can then be part of the party's policy development process coming into the election anyway. So I think, yeah, like I was saying before, I think use the information and sort of go forward with the advocacy. Don't just wait for Homelessness Australia to sort of lead that process. But, you know, I think that independent advocacy is really part of the picture as well. Any other questions? Did just want to, I'll just bring it up and share with you just there another element that you can bring into messaging with government about homelessness is that yesterday the AIHW released a new feature analysis information that they've never pulled together before, using linked data between the register of deaths across Australia, and then linking that with interactions. So they've produced interactions with homelessness services. So they've produced a report looking at 10 years of data of people who've passed away, and digging down into the people who in their last year of life had interacted with homelessness services. And it reveals that people who are homeless are 1.8 times as likely to die as other people in the community. Just share the screen. So this is from the AHW website. I'll put the link in the chat, but it gives us a whole lot of information about people in the last year of life. So it's a little bit hard to sort of see on the screen. Here we go. Here's a chart. It's probably the best thing to look at. So this is the number of people who've died, who've been interacting with homelessness services over time. So obviously you can see this orange line is really increasing, which is terribly concerning. So up to almost 1,500 people a year passing away. And another element which really highlights the importance of homelessness services is that find it down here, the underlying causes of death among this group who are interacting with homelessness services and who have died. The biggest one is this blue line is accidental poisoning, which is a technical term for overdose. And the pink line is suicide. So, you know, obviously, you know, I've been describing these as sort of deaths of despair among people. And I think not being able to access the support that you need when you're in crisis really feeds into that despair that people find themselves in. And then a lot of the other causes of death are what we would call chronic health conditions as a sort of group. So we've got heart disease, liver disease, cancers, diabetes. So that, you know, I think that really talks to people's getting the responses in the health system that they need, and obviously often people who are homeless being quite excluded from health services or just not able to maintain their health when they're rough sleeping and other forms of homelessness. So, sorry, that's pretty dark data to share, but I think it does really flesh out the picture about why this is, you know, super important that we fix this problem. So, yeah, I think that's probably I should give everyone an early pass and finish up. Is there any other questions? No. So thanks to everyone for being involved. And I should actually, before I finish up, also acknowledge that actually we're only able to publish the Call Unanswered report because organisations in the homelessness sector assisted with resourcing it. So let me just bring up the slide so I can just properly acknowledge the organisations who contributed, which included Homelessness New South Wales and Launch Housing and Mission Australia and Wesley Mission and Uniting Communities. It was kind of quite a big group of organisations, so it's fantastic. And Council to Homeless Persons, DV New South Wales, St Mary's House of Welcome, MELI, Southern Youth and Family Services, Toward Home and Women's and Girls Emergency Centre and Safe and Equal. So thanks to all those organisations for making this possible, because I think the research, some research that you launch is useful in terms of messaging, you know, just when you launch it, and then it sort of quickly is out of date. But I'm expecting we'll be digging down into all the rich data in the Call Unanswered report for at least 6 months, if not a year, if not even longer. But it really does tell an important story. So thanks to Nathan and Angela for all the work putting it together. And thanks to the funders for making it happen. And thanks to everyone for being interested, engaged and participating in the campaign. So it's wonderful to see you all here, and we'll keep you up to date with the campaign. So thanks everyone.